This is Chapter 12, Question 2. The rectus abdominis can be palpated at the anteromedial surface of the abdomen between the rib cage and pubic bone with isometric trunk flexion. The external oblique abdominal can be palpated with the subject supine and then palpate lateral to the rectus abdominis between the iliac crest and the lower ribs with active rotation to the contralateral side. The internal oblique abdominal is with the subject supine and then palpate anterolateral abdomen between the iliac crest and the lower ribs with active rotation to the ipsilateral side. And the erector spinae can be palpated deep and difficult to distinguish from the other muscles in the cervical thoracic regions with the subject prone palpate immediately lateral to the spinous process in the lumbar region with active extension. The sternocleidomastoid is the anterolateral neck diagonally between the origin and the insertion, particularly with rotation to the contralateral side. The splenius cervicus is palpated in the lower posterior cervical spine just medial to the inferior levator scapula with the resisted ipsilateral rotation, and the splenius capitis is deep to the trapezius inferiorly and the sternocleidomastoid superiorly, with the subject seated palpate in a posterior triangle of the neck between the upper trapezius and the sternocleidomastoid with the resisted rotation on the ipsilateral side. And the quadratus lumborum is with the subject prone just superior to the iliac crest and lateral to the lumbar erector spinae with the isometric lateral flexion.